And I'm doing a curriculum called Where to Find, which is basically translating from the Arabic Aina Alif, like where to find something. So this is my presentation's outline. So first of all, I would like to point out some considerations. The curriculum I'm developing is going to be in Arabic, but all my display today is going to be in English. The other thing is, because the course is just 1 week and very compact, I didn't have time to do very thorough literature review or extensive background research. So I want to give you some context, which is basically about the Ministry of Health and the project that I'm doing. The Ministry of Health is the main entity providing healthcare for the citizens in Saudi Arabia. We have other sectors that provide health, the military, education, and the private sector. I want to show you an overview of the website that they have, so you'll have some idea what I'm talking about. This is a video that's actually on the ministry's YouTube channel.
Ministry of Health. Welcome to the Ministry of Health portal. www.moh.gov.sa. Within the Ministry of Health's approaches aiming to create an ideal interactive communication environment and enhance communication with the citizens and residents of the Kingdom of Saudi Arabia, MOH Portal has been launched in order to enable them to communicate with MOH and access its services easily. The MOH Portal includes 4 main sections. The first couple of sections brief portal's visitors about the ministry's organizational structure and sectors. In addition, these sections enable the visitors to contact the minister's office, ministry's directorates, medical cities, hospitals, and primary health centers. Moreover, the third section provides visitors with several beneficial electronic services, such as Citizen Voices System, employment services, medical licenses, staff services, and other services. On the other hand, the fourth section enriches visitors with educational information covering several topics like awareness campaigns and World Health Days. It also offers some helpful health tools suitable for all ages, such as body mass index, ideal body weight, calorie calculate, and other tools. Nevertheless, the portal enables its visitors to share and exchange health information, creating an interactive community through its forum, in addition to the social media channels available on the portal. In addition, MOH Portal includes many features, such as adjustable layout colors, font size, and automatic reading. Furthermore, the portal seeks to keep its visitors updated with the latest news via Ministry News and What's New. On the other hand, MOH Portal visitors can participate and express their meaningful and constructive comments and opinions through the communication channels available at the portal. These channels include creating new accounts, e-participation, and poll and voting service, a survey measuring visitors' satisfaction and awareness regarding MOH services and matters. The Ministry of Health portal contributes to improving healthcare performance in the Kingdom of Saudi Arabia, providing its visitors with a variety of services and health information. www.moh.gov.sa. MOH Portal, Healthcare Services and Awareness.
So that gives us an idea of what I'm trying to tackle. Yes. So as you can see, the tabs, there are 4 main tabs, and then under them there's like just this huge list of everything. And from the things that they were explaining, you'd notice that there's an overlap between services and information that's for professionals and that's for for the consumer or the public. The ministry in the past few years has strongly been present on social media, so that's an advantage. So they have Snapchat, Instagram, Twitter, Facebook, YouTube, and a lot of people do follow them. And I do believe that people find them as a credible source of information, but I was discussing with Sabrina yesterday, and that could be like further research just to make sure that that's really what they think.
Mm-hmm.
I want to briefly talk about the curriculum. So the content is basically YouTube videos that are going to help people access and understand and utilize health information that's reliable from the ministry's website. The time allocated, so as long as the ministry's channel on YouTube is there, it's supposed to be available to people. However, the videos themselves, I'm aiming to have them less than 4 minutes. And that's because I read a lot of research about like the optimal time of YouTube videos, or videos in general, that are educational.
What if you could expedite the hiring process? Imagine saving time focusing your energy on productive and safe job
Be glad it was G-rated.
The instructor, this is something I'll come on to later in the needs assessment. So I'll be asking the people later on, would they want it to be like a tutorial where there's no face, just a voiceover and they see the screen, or would they want it to be a face that's explaining something in front of them? They want it to be like a healthcare provider, or they want it to be someone from the community showing them as if it's peer-to-peer. Methods of instruction. So as I said, it's online, so it's online asynchronous method of teaching. Or instruction. The logic model, so the inputs are financial input, human resources, and computer and internet or equipment required for the recording the tutorial. The outputs, so the activities are the video tutorials themselves. The participants, so I have two categories: the stakeholders, which is the Ministry of Health, the project manager, the logistics, health communication specialist, hopefully me, and then the video producer. And then there are those served, which are 18 to 45-year-old residents of Saudi Arabia. And I chose that age group because they use social media heavily in Saudi Arabia. So that's why I chose them. My outcomes, short-term outcomes, are basically the numbers of views and shares. However, my medium term are that I want, of course, the community members to be able to access, understand, and use reliable health information from the Ministry of Health website. Long term is that I want to improve the health literacy of the community in my country. Assumptions, I'm assuming that the Ministry of Health is in on this, and the external factors that I don't have a hand in are government budget cuts. And another thing is if suddenly there is a need for the Ministry's health communication to be directed towards like a public health crisis. And this happened around 2 years ago when we had the coronavirus epidemic in Saudi Arabia. So a lot of the ministry's work was towards that. So what has been done? So the Ministry of Health themselves on their YouTube channel, I found that they have tutorials that are geared towards their staff. And basically it's for them how to use, they have like a human resources portal. So it's basically tutorials that are 2 minutes or less that show people how to apply for a vacation and stuff like that. So this makes me optimistic that this is something that they already did. So it's not that I'm proposing something out of the blue. And the other thing is that they did have this short video length, which is something I was afraid that they might, like what if they're already doing very long things that would be hard to convince them to do something very short, but that's not the case. The other thing is Medline Plus. So Medline Plus has reliable health information geared towards the general population. And they have a video that basically it's a tutorial that tells people how to assess health information that they find on the internet in general and how to decide if it's accurate. The other one is they have a tutorial that's interactive for people to understand medical terminologies. And in their frequently asked questions section, they had a question that said, how do I find information about my health condition? And I felt this is maybe the most pertinent to my project. And they just listed out steps in writing form, not in video. Needs assessment, I plan on doing an online survey and key informant interviews and website usability testing, because I believe that the website is not easy to navigate, but I really want to pinpoint what are the things that people find hard and difficult when they want to find out about a certain health topic. Theoretical framework, so I'm going with the school that uses some constructs from every theory, and the adult learning theory, I'm gonna state the video's objectives at the beginning of each video, and then also when we're talking about like the social role of the person, so I'm gonna try to incorporate that when I'm with the key informant interviews. I'm gonna try to make that help me choose the topics that we're gonna do the videos about. So an example is, for example, the parents' role, they're looking for vaccinations for their children, and so forth. Social cognitive theory, I'm thinking I'm taking the modeling construct where I'm modeling the actual steps. And health belief model, self-efficacy, so I want the video to be easy. I want it to be that the viewer would feel confident when the video is over that this is something that they can actually do. And then call to action, which is the clickable link at the end of the video. The people just click it and immediately go to the website. So measurable objectives. So after watching the video, I adjusted them from yesterday. The viewer will visit the MOH website. Will be able to go to health information pages, example vaccination page. Will be able to call 937 hotline to further inquire and understand health information. Will be able to go to related services like the vaccination reminder service. And in some situations when it's applicable, they will be able to list some features available on the services page. So evaluation. This is something that I found very interesting, and I showed it to the group yesterday in the discussion because I was very happy that I found it. So there's something called Think with Google, and so this is my first time to find it. So as most of you might know that YouTube is now part of Google, and Think with Google is basically they help tell you like the trends and analytics of Google and Google products. And they had this article that said how do you evaluate your YouTube videos, and it's of course especially geared towards brands that are trying to advertise through YouTube. And so they said key performance indicators divided into 3 categories. So you've got awareness. It depends on the goal that you want from your ad, or from why you're using the ad on YouTube. So if you want them just people to notice you, or do you want them to consider doing the thing, or do you want them to actually do an action? And every yesterday in the discussion, he was saying this is more like knowledge, attitude, and behavior. You can relate them to that. And so they have the key performance indicators is for awareness, it's like views, impressions, unique users, consideration. So for example, view through rate, and I went on and tried to read most of these things, what do they mean, because some of them are terminology that's specific for Google. So like view through rate was basically, you know, these skippable ads that come at the beginning of the videos. So if you look through them and then you don't skip it, so that's called a view through rate. And then there are actions where you sign up, you call, you click. So then they propose the tools that you can use to actually measure these indicators. So you've got YouTube Analytics, Google Analytics, and AdWords. And then BrandLift, which is like marketing and branding company that Google did for people that want to put their brands on like YouTube and stuff. And then Google's consumer surveys. And they show you like each one, how does it fit within the 3 categories and with the indicators. So for my evaluation, what I'm going to do, I put them here in two groups, the outcomes and the process